is WOWT 6 News, live at 6.
Good evening, I'm Mallory Maddox.
And I'm John Nicely. We begin with breaking news.
We are tracking it just into our newsroom in the last 20 minutes.
Second Ebola patient to be treated at Nebraska Medical Center is virus-free.
The CDC has confirmed a negative blood test from Ashoka Mukpo. Mukpo spent a little more than 2 weeks inside the biocontainment unit. We are told he will be released and will speak to the media tomorrow. Now to our top story. The Ebola conversation has been front and center in the metro since September 5th. And
that is the day that Dr. Rick Sacre arrived at Offutt Air Force Base to be treated at NMC. While public concern over Ebola continues to rise and fall, Brian Mastery is learning tonight that some of the concerns hit very close to home.
When Dr. Rick Sacre left the Nebraska Medical Center free of Ebola last month, those who took care of him dressed in the same T-shirts and bid him a fond farewell. After all, they had been training for this moment for 9 years, and he was their first patient. Doctors felt that his positive ending would help alleviate the growing fears over Ebola. But then came the death of Thomas Duncan and the Dallas healthcare workers who got sick after treating him. And now we're hearing of what some of the healthcare workers at Nebraska Medicine are enduring when they go home.
Having people shunned at parties or soccer games or what have you because their parents are participating in the care of a patient is totally irrational fear.
So what does that mean here, shunned? Well, in one case, a child of a biocontainment unit employee was uninvited to another child's birthday party. And there's been more pushback against those caring for the Omaha Ebola patients. Another worker wasn't allowed to see a newborn in the family. Another nurse faced all sorts of questions about whether she was fit to coach soccer considering her job.
Irrational fear is just paralyzing us in our daily lives.
Infectious disease expert Dr. Rupp seemed to bring up some of these examples with the hope that the public would better understand what's rational and what's irrational when it comes to Ebola. That even with all the coverage nationwide, the educational needle on the virus still needs work. A birthday uninvite is an example of that. But Omaha healthcare workers aren't alone in this.
Hospitals and clinics all across the country are facing this. This is not something that is unique to Nebraska Medicine.
John, Mallory, we're live on the Nebraska Medicine campus where a lot of people will be excited to hear from Ashoka Mukpo tomorrow morning now that he's been declared Ebola free. But we wanted to pass this along to you, a recent timely survey by the Kaiser Foundation on Ebola misconceptions, and there are a lot of them. Like, look at the numbers. For example, 1 in 3 incorrectly think you can catch Ebola by shaking hands with a healthy person who was exposed to the virus, and nearly a quarter believe it's transmitted through the air. Experts say it is not. Reporting live with photographer Jim Hinchek, Brian Mastery, WOWT 6 News.